Hello, and welcome to this lecture discussing the peripheral and autonomic nervous system. My name is Laura McLeod, and I'm an instructor here at Ultimate Medical Academy. In this lecture, we'll be going over the nerves and how they specifically interact with the body. First, let's discuss what periphery actually means. In talking about the body, periphery means the part that is away from the central or core of the body. So, anything that is outside of the central nervous system or outside of the brain and spinal cord would be considered the peripheral nervous system. The peripheral nervous system, also known as PNS, is divided into several smaller units. This is shown here in figure 9-1. The peripheral nervous system consists of all the nerves that connect the brain and spinal cord with sensory receptors, muscles, and glands. The PNS can be divided into two subcategories: the afferent peripheral system, which consists of afferent or sensory neurons that convey information from receptors in the periphery of the body to the brain and spinal cord. Second is the afferent peripheral system, which consists of afferent or motor neurons that convey information from the brain and spinal cord to the muscles and glands. The afferent peripheral system can be further subdivided into two subcategories itself. First is the somatic, that relates the brain and spinal cord to skeletal muscle. The second is the autonomic. This relates the brain and spinal cord to smooth muscle. Let's look a little bit further into the afferent peripheral system. First, the somatic nervous system. This conducts impulses from the brain and spinal cord to the skeletal muscles. This causes us to respond to changes in our external environment. Next is the autonomic nervous system. The autonomic, or rather automatic, it conducts impulses from the brain and spinal cord to smooth muscle tissue. An example of this would be how food is pushed along the digestive tract and how the glands of the endocrine system are stimulated. The autonomic nervous system is involuntary. It can even get further subdivided into sympathetic and parasympathetic divisions. The sympathetic division stimulates or speeds up activity, and which it requires an energy expenditure and uses norepinephrine as a neurotransmitter. The parasympathetic system, it actually speeds up the body's vegetative activities, such as urination and digestion, and this restores or slows down other activities. It uses acetylcholine as a neurotransmitter. In this figure, you can see how the network of the nervous system works like a tree. First, breaking into the central nervous system and peripheral nervous system, and then seeing the peripheral nervous system break down even further into the somatic and autonomic divisions. From there, you can see where it has sensory and motor neurons that extend out to the rest of the body. A nerve is actually a bundle of nerve fibers enclosed by connective tissue. If the nerve fibers carry impulses from the sense organs to the brain or spinal cord, it is called a sensory nerve, which is an afferent nerve. If its fibers carry impulses from the brain or spinal cord to muscles or glands, it is known as a motor nerve, the afferent nerve. And if it contains both sensory and motor fibers, it is called a mixed nerve. Here is an illustrated diagram of how nerves look within your body. You can see how small a single nerve fiber is here and how they are clustered together by connective tissue and then clustered together again. It really is amazing how many nerves we have running through our bodies and how they all interact simultaneously with one another in the most unique way. Cranial nerves are part of the peripheral nervous system. The 12 pairs of cranial nerves originate from the brain and brainstem. The cranial nerves are designated by number and name. The name may give you a clue to its function. Cranial nerves are identified with Roman numerals and are named for the area or function they serve. The spinal nerves originate at the spinal cord and are each connected to a specific segment of the spinal cord. They exit through the openings in the vertebra. Each pair of spinal nerves is connected to that segment of the cord by two pairs of attachments called roots. The posterior or dorsal root is the sensory root and contains only sensory nerves. It conducts impulses from the periphery, like the skin, to the spinal cord. The other point of attachment is the anterior or ventral root. This is the motor root. It contains motor nerve fibers only and conducts impulses from the spinal cord to the periphery like muscles. It connects with the ventral gray horn of the spinal cord. There are actually 31 pairs of spinal nerves, 31, and all are mixed nerves because they contain both sensory and motor fibers. They are named according to the region and level from which they emerge. There are 8 pairs of cervical nerves. This is C1 to C8. 12 pairs of thoracic nerves, T1 to T12. 5 pairs of lumbar nerves, L1 to L5. 5 pairs of sacral nerves, S1 to S5, and this is also known as a sacrum. And 1 coccygeal nerve, also known as the coccyx. The functions of the cranial nerves are concerned mainly with the activities of the head and neck, with the exception of the vagus nerve. The vagus nerve, or cranial nerve 10, is responsible for activities involving the throat as well as regulating the heart rate. It also affects the smooth muscles of the digestive tract. Most of the cranial nerves are mixed nerves. This means that they carry both sensory and motor fibers. The olfactory, optic, and vestibular-cochlear nerves, however, carry only the sensory fibers, meaning they only respond to stimuli. First, the olfactory nerve, the cranial nerve 1, is responsible for the sense of smell. The optic nerve, cranial nerve 2, is responsible for vision, at least one of them. The oculomotor nerve and trochlear nerve are cranial nerves 3 and 4. They are responsible for the muscles of the eye. The trigeminal nerve, cranial nerve 5, is responsible for the sensory nerves to the face, sinuses, teeth, and more, and the motor nerves to the muscles that are used for mastication, or eating and chewing. The abducens nerve, cranial nerve 6, is another nerve responsible for the muscles of the eye. The facial nerve, cranial nerve 7, is responsible for what its name suggests, the muscles in the face. The vestibular-cochlear nerve, or cranial nerve 8, is responsible for the inner ear and helps with the sense of hearing. The glossopharyngeal nerve, cranial nerve 9, has both motor and sensory purposes. The motor portion contributes to the pharyngeal musculature. This means it contributes to the pharynx and helps push food down the throat. The sensory nerves contribute to the posterior or back of the tongue, the tonsil, and the pharynx. The vagus nerve, cranial nerve 10, also has both motor and sensory nerves. The motor portion contributes to the heart, lungs, bronchi, and gastrointestinal tract. The sensory nerves contribute to the heart, lungs, bronchi, trachea, larynx, pharynx, gastrointestinal tract, and the external ear. The spinal accessory, or cranial nerve 11, has nerves contributing to the sternocleidomastoid and trapezius muscles. These are the muscles that contribute to turning or nodding your head, and the muscle that moves your scapula, or back of the shoulder, and supports the arm. The hypoglossal nerve, cranial nerve 12, has nerves contributing to the muscles of the tongue. Within the spine, there are spinal nerve plexus. First, the cervical plexus. This is C1 to C4. This supplies motor movement to muscles of the neck and shoulders and receives messages from these areas. The phrenic nerve is part of this group and stimulates the diaphragm. Next, the brachial plexus. This is C5 to C8 and T1. It supplies the motor movement to the shoulder, wrist, and hand and receives messages from these areas. Radial nerve is part of this group and stimulates the wrist and the hand. Impairment to the radial nerve can result in what's called a wrist drop. Lumbar plexus is the next one, and this is T12 and L1 to L4. This supplies motor movement to the buttocks, anterior leg, and thigh, and receives messages from these areas. The femoral nerve is part of this group and stimulates the hip and the leg. Finally, there is the sacral plexus. This is L4 to L5 and S1 to S2. This supplies motor movement to the posterior of the leg and thighs and receives messages from these areas. The sciatic nerve is actually the largest nerve in the entire body and is part of this group. It passes through the gluteus maximus and then down the back of the thigh and leg. It extends the hip and flexes the knee. The autonomic nervous system includes nerves, ganglia, and plexuses. These carry impulses to all smooth muscle, secretory glands, and the heart muscle. It regulates the activities of the visceral organs, such as the heart and blood vessels, respiratory organs, kidneys, urinary bladder, and reproductive organs. The activities of these organs are usually automatic, which means it's not subject to conscious control. The autonomic system has two divisions, the sympathetic and parasympathetic. These two divisions may be antagonistic in their actions. The sympathetic system may accelerate the heartbeat in response to fear, whereas the parasympathetic slows it down. Normally, the two divisions are in balance. The activity of one or the other becomes dominant as dictated by the needs of the organism. Let's first look a little bit further into the sympathetic system. The sympathetic system consists primarily of two cords. These begin at the base of the brain and proceed down both sides of the spinal column. This means that they're just lateral to the vertebra. These consist of nerve fibers or ganglia of nerve cell bodies. The cord between the ganglia is a cable of nerve fibers, closely associated with the spinal cord. Sympathetic nerves extend to all of the vital internal organs. These include the liver, pancreas, heart, stomach, intestines, blood vessels, the iris of the eye, sweat glands, and the bladder. Have you ever wondered why, when you're under stress or if someone scares you, your body reacts? This is due to the sympathetic nervous system. It's actually often referred to as the fight or flight system. When the body perceives it is in danger or under stress, it prepares to run away or stand and fight. The sympathetic nervous system sends a message to the adrenal medulla, which secretes its hormones to prepare the body for this action. Think about how you feel when you are facing a major test, or maybe when you're waiting in the physician's office for test results. You can feel your heartbeat racing and your mouth going dry. All the results are from the automatic response to nature. During the danger, this is how your body can react. When the danger passes, the parasympathetic nervous system then comes in and will help restore the balance to your body system. The reality is that sometimes we stress too much, right? Well, if the system gets too much of the stress hormones, health problems can result. Learning to live with stress is the key to a healthier body. There are a lot of different ways we can try to put a handle on the stress that is in our lives. Some people choose things like exercising, meditating, removing what is causing the stress, maybe eating healthy, some choose to look at their faith, and some just need to have someone to talk to on a regular basis, like a therapist or even a good friend. Now, let's take a look at the parasympathetic system. The parasympathetic system has two important active nerves. There's the vagus and the pelvic nerve. First, the vagus nerve. This extends from the medulla and proceeds down the neck and sends branches to the chest and neck. The pelvic nerve emerges from the spinal cord around the hip region and sends branches to the organs in the lower part of the body. Both the sympathetic and parasympathetic nerves are strongly influenced by emotion. During periods of fear, anger, or stress, the sympathetic division acts to prepare the body for action. The effects of the parasympathetic are generally to counteract the effects of the sympathetic. For example, the sympathetic nervous system increases the rate of your heart muscle contraction, and the parasympathetic decreases the rate. The two systems operate as a pair, striking a nearly perfect balance when the body is functioning properly. This is called homeostasis. The reflex arc is a basic pathway that results in a reflex, the simplest type of nervous response, which is unconscious and involuntary. The blinking of the eye when a particle of dust touches it, the removal of the finger from a hot object, the secretion of saliva at the sight or smell of food, and the movements of the heart, stomach, and intestines are all examples of reflex actions. Every reflex act is preceded by a change in the environment called a stimulus. Examples of stimuli are sound waves, light waves, heat energy, and odors. Special structures called receptors pick up these stimuli. For example, the retina of the eye is the receptor for light. Special cells in the inner ear are receptors for sound waves, and special structures in the skin are the receptors for heat and cold. A simple reflex is one in which only a sensory nerve and a motor nerve are involved. The classic example is the knee-jerk reflex. The knee is tapped and the leg extends. This test is used by physicians to test both the muscle and the nervous systems. Reaction to a stimulus is called a response. The response may be in the form of movement, in which case the muscle or the effectors are responding organs. If the response is in the form of a secretion, the glands are the effectors. Reflex actions are autonomic reflexes involving the skeletal muscles, which are controlled by the spinal cord. They also may be called somatic reflexes. The following is a list of disorders specific to the peripheral and autonomic nervous system. Neuritis is an inflammation of a nerve. Symptoms may be severe pain, hypersensitivity, loss of sensation, muscular atrophy, weakness, and possibly tingling, burning, and crawling of the skin. The causes of neuritis may be infectious, chemical, or due to other conditions such as chronic alcoholism. Peripheral neuropathy is a term used to describe damage to the peripheral nerves. It is a frustrating and painful nerve condition that affects millions of Americans. The most common form involves damage to multiple nerves and is frequently caused by diabetes. Sciatica is a form of neuritis that affects the sciatic nerve alone. The cause may be a rupture of a lumbar disc or arthritic changes. The most common symptom is pain that radiates through the buttock and behind the knee down to the foot. Neuralgia is a sudden, severe, sharp stabbing pain along the pathway of a nerve. The pain is often brief, and it may be a symptom of a disease. The various forms of neuralgia are named according to the nerve they affect. Trigeminal neuralgia is a condition that involves the fifth cranial nerve. The cause is unknown, the onset is rapid, and the pain is severe. The spasm of pain can be brought on by so slight of a stimulus as a breeze, a piece of food in the mouth, or even a change in temperature. Bell's palsy is a condition that involves the seventh cranial nerve. The patient with Bell's palsy appears as if he or she has had a stroke on one side of the face, because Bell's palsy affects only one side. The eye does not close properly, the mouth droops, and there's numbness on the affected side. The cause of this is unknown. Shingles is an acute viral nerve infection. It is characterized by unilateral inflammation of a cutaneous nerve. The intercostal nerves are the ones most commonly affected. The course of nerve inflammation can spread to any nerve. Finally, carpal tunnel syndrome is a condition that affects the median nerve and the flexor tendons that attach to the bones of the wrist. At the base of the palm is a tight canal or tunnel through which tendons and nerves pass on their way from the forearm to the hand and fingers. The median nerve and flexor tendon pass through this tunnel. The syndrome develops because of repetitive movement of the wrist, while the hands are held in an unusual position. Anesthesia deals a lot with the nerves because through medicine, we can block the nerve impulses so that the patient cannot feel pain or discomfort during a procedure. If you've ever had a surgery done, a procedure in a doctor's office, or maybe even dental work, you have most likely had some sort of anesthesia. Local anesthesia is when an anesthetic agent is used to temporarily stop the sense of pain in a particular area. The patient is conscious or awake. For major surgery, options include regional anesthesia or general anesthesia. In some conditions, the anesthesiologist may actually combine regional and general anesthesia. Regional anesthesia types include the following: spinal, which temporarily blocks nerves signals to and from the lower part of the body. The spinal anesthetic is delivered into the subarachnoid space. The local injection is given to numb the injection site. The patient remains conscious. However, the patient may receive a sedative for relaxation. Once the drug has taken effect, numbness occurs in the lower body. This type of anesthesia most often is used in orthopedic surgery. Epidural anesthesia. Similar to spinal anesthesia, medications are injected into the epidural space, which is outside the subarachnoid space. A catheter is inserted to allow for repeated injections if necessary. This method is used frequently in childbirth. General anesthesia is appropriate for extensive surgery that requires the patient to be unconscious, or when regional anesthesia is not an option. Medications are delivered intravenously or are inhaled. All vital signs are closely monitored during surgery. A breathing tube may also be inserted. General anesthesia induces a deep sleep, blocks the memory of the surgery, and keeps the brain from perceiving pain. Because medications are delivered to the patient's general circulation, they may produce side effects such as nausea and vomiting, muscle aches, dry mouth, sore throat, shivering, sleepiness, and inhibited bowel function. These side effects are generally temporary. I want to thank you for attending this lecture. If you have any further questions on this topic, please don't hesitate to reach out to your instructor.